For years, we've heard mixed messages about PSA screening. Don't test. Test, but be careful. It can cause harm, more harm than good. And somewhere along the way, too many men, especially Black men, started kind of tuning things out. Now, in this episode, we're cutting through the noise. No more myths, no more confusion, no fear-based decisions, just clarity. And that's coming up next. Stay with us. I'm Reggie Hicks, your host for the If You Are My Brothers podcast. I want to welcome everyone watching on YouTube, Facebook, and LinkedIn Live, and to those listening on your favorite podcast platforms. Thank you for being with us on this episode. We had our new opening, so we hope you enjoyed that. Thanks to Zach Reynolds at Borkhouse Productions for doing that for us. Been away a while, but we're back. We've got a lot of shows coming up in the next month or so, next 2 months actually. So stay tuned and we'll be telling you more about that and other episodes as well as on our website. Now, we want to remind you, as we always do, to share, subscribe, and of course, engage in what we're doing. You can always leave us a message. You can give us a call. You can do whatever you need to do to react or connect with us if you have any questions or concerns. We're here for you. And remember, this is a conversation, so we definitely look forward to your feedback. Now, I'm really excited about our guest for this episode. Dr. Stacy Loeb is a professor of urology and population health at the New York University School of Medicine and the Manhattan Veterans Affairs Medical Center. She's a board-certified urologist specializing in prostate cancer and men's health. Also, Dr. Loeb is board-certified in lifestyle medicine. Now, she has over 500, that's right, 500 peer-reviewed publications. And here's my favorite. She also hosts the Men's Health Show and the Prostate Health Show on Sirius XM Radio. And I think you can hear it, of course, if you have Sirius XM in the U.S. and in Canada. So, Dr. Loeb, thank you so much for being on and joining us. I have a celebrity. I can't, it's hard for me to contain my excitement. And thank you so much for all the work that you've been doing and continue to do. I've watched just about all of your YouTube videos, and just the information is great. And the way you present it, I could tell that you just have such dedication for this. And I appreciate you sharing this with everyone that'll be watching in our little group here of If You Are My Brothers. So before we get started, I was going through the questions and I kept typing up PSA, because I know what PSA is, but I thought if we're going to talk about it, we might as well start at the beginning and maybe you give us the definition of PSA.
Amazing. Well, thank you again for the invitation. And PSA, certainly, it's a challenging topic. PSA is a blood test. It is the screening test for prostate cancer. And you know what? It's faced a bad rep over the years, but I really think it's unfounded because it is a simple blood test. And listen, it's not perfect, but it's kind of like the check engine light in your car, right? So if it goes up, it's not always cancer, but it could be something else like inflammation or enlarged prostate. So what the check engine light tells you is it tells you something's happening in there. You got to look under the hood. And that's what's happening here. But it is a very important indicator because it's our only indicator. And you know what? There's so many myths going on prostate cancer. We actually have a grant from the National Cancer Institute where we've been looking at posts on YouTube, Instagram, and TikTok about prostate cancer and just looking at all the myths that circulate out there on social media in English and Spanish. And one of the most common myths that I see is if you have blood in the urine, if you're waking up at night to urinate, if you have bone pain, these could be signs of prostate cancer. And it's like, no, actually, prostate cancer doesn't have any symptoms at an early stage. That's the whole problem. That's why we need PSA, because if you wait until you have bone pain, that's a late stage, right? So it's really great that we actually have a simple blood test that can be an early indicator. Now, why was it so controversial for so many years? Well, it's because it's not a perfect test. And so when it goes up, it isn't always cancer. And so if people, the minute it goes up, if they have a biopsy, a lot of the time the biopsy is negative, it doesn't even show cancer. So somebody just had an invasive procedure with risks. Or sometimes there's a cancer that is pretty indolent. It's not aggressive at all. It doesn't need to be treated. And if somebody gets scared and gets treated, they could have side effects from treatment of a cancer that wasn't going to cause any harm. But you know what? We've done so much over the years to help with those issues. So now we don't just do biopsies the minute the PSA goes up. There's actually all kinds of other tests that you can use to check when the check engine light comes on. Is it cancer or is it one of these other things? And we have blood tests, urine tests, MRI, lots of steps that are not invasive that we can take to help parse this out before somebody even proceeds to the biopsy, to the invasive stuff. And then similarly, even if someone's diagnosed with prostate cancer nowadays, many people don't get treated. We do a lot of what we call surveillance or watching the cancer if it's not aggressive. So bottom line, back in the day, the way we were using PSA maybe wasn't ideal, but I think we really have gotten it down now, and it's just so important, and especially for Black men, due to a higher risk of death from prostate cancer. So we want to find it early.
Right. When I was diagnosed, I had no symptoms at all, and my PSA was relatively low. But we're going to talk about, for me, just tracking the PSA over time. But let me ask you this. I remember some years ago reading, it might have been from the American Cancer Society, I can't remember, when they recommended not to get a PSA. I mean, it was kind of like, well, we won't put that much importance in the PSA because there were a lot of treatment that was being done that some considered you didn't need it. Men would kind of overreact. And so I know that we've kind of backed off that. We've, like you said, now we've sort of know the best way to use PSA. But do you think that, are we moving more back to more screenings, or have we finally kind of landed on a good place where we're really at a place where we can use PSA properly?
It's a great question. I mean, certainly we're better off than where we were, what you mentioned, right? So as the U.S. Preventive Services Task Force was the group that actually recommended against PSA for a number of years in there. And I think it's really caused some serious long-term damage, actually, because a lot of people just weren't offered or even given the option of this test. They didn't necessarily know about it. I mean, if you don't have a medical background, how are you supposed to know? And if the doctor isn't even telling you or offering it. Now, luckily, they did reverse that decision. And now it is really a consensus, I would say, across all organizations: the U.S. Preventive Services Task Force, American Cancer Society, National Comprehensive Cancer Network, American Urological, all these groups. It's the same thing, that patients should be told about this test and the benefits and the harms and given a choice to have it. And so I think it's very important that people at least are offered. Now, that doesn't mean that everybody is, and I think it's still not perfect, but at least it's gotten a little better in terms of guidelines recommending that there be a discussion about this with patients who are of screening age.
Yeah, because I remember when I saw that, I said, oh, all we need is an excuse not to do something as men. It's like, oh, well, they're saying we don't have to really do this PSA thing. And so, we always connect the PSA to the DRE. And it says, I don't even have to deal with that. So I'm glad we've shifted from that.
Well, now that you mentioned the rectal exam or the prostate exam, I will say I think that's been a huge deterrent over the years, is because people just equate prostate cancer screening with rectal exams. And in this social media study we've been doing, we see a lot of that too. And people even make a joke about it, like, I'm coming after you with the finger, But I think that actually does a lot of harm. I mean, it may be funny, but people are terrified, and then they don't want prostate cancer screening, and there's so much stigma. And so one piece of good news, I would say, is that it has moved a bit into the second line in guidelines now, where it isn't really the upfront screening at all. It's just the blood test. And then that becomes reserved if it's elevated as one more additional test that can be used to help parse this out. So I think for the listeners who are in the screening population and thinking about this, to not get deterred by fear of a rectal exam, you can absolutely do the blood test without the rectal exam and still get a lot of information that can help you make decisions about your risk.
So, what age should men start thinking about PSA screenings now? And what does that mean? Is it different for men of color?
Mm-hmm. This is a very good question. So, absolutely, for men of color, definitely to begin starting at age 40. The same would apply for anyone who has a family history of prostate cancer or anyone who has a family history of any kind of genetic condition that is associated with prostate cancer. Now, a lot of people have heard of things like BRCA genes in conjunction with breast cancer and Angelina Jolie and all of that stuff. But actually, it's also associated with prostate cancer risk. So if your family has one of these genetic conditions, that would be another population where early screening is very important. Now, to tell you the truth, I spent a lot of my early years researching PSA. And I spent a lot of my time researching baseline PSA values in the 40s. And what we found is actually the baseline level in the 40s is a really good predictor of your future risk of ever developing aggressive prostate cancer in your lifetime. So I'm actually a proponent of everyone starting in the early 40s, whether you're a person of color or family history or not. And for these people who don't meet those criteria, that baseline level also provides a good indicator of their level of risk, because there's a lot of people who maybe they don't know their family history. And so how would you even know if you're at high risk or not? And so that baseline level gives a lot of information. It also tells us how carefully we need to follow. So now a lot of the guidelines actually have more of a tailored approach to screening, where if the baseline level's on the higher side, we would want to follow it up more quickly. Whereas if it's very low, you could even wait several years before checking again.
So that being said, if you're going into your urologist or your doc and you're in your 40s and you get the baseline, is it a specific number? Is it if your PSA is 1 or higher means what in that case? And let me ask you this. In looking at that, do you think that across the board, like everybody, healthcare providers kind of know if the baseline is here, we need to track it a little closer. If it's down here, maybe not so much. Is that pretty much the standard operating procedure these days?
Well, it is now a part of guidelines, for what it's worth. So the National Comprehensive Cancer Network guidelines, for example, they do stratify based on whether that baseline PSA is over 1 or not. And so if it's less than 1, then they say you could wait even 2 to 4 years before checking again. Whereas if that baseline is over 1, then you do it every 1 to 2 years. So it's in there. And so 1 would be a reasonable number that's easy to remember. When I was mentioning those early studies that I did, we looked at over 36,000 men walking around on the streets and what is their PSAs in the 40s and the 50s. And so the median level that we found in the 40s was 0.7 and in the 50s was 0.9. So really, like if you're above 1, at those ages, it's above the median. Now, that doesn't mean anything needs to happen, right? I mean, if it's 1.2, we're not worried that you have prostate cancer. We're not going to do anything, but it's just an indicator for you to keep track of and understand. This is just another data point as to your level of risk for future prostate cancer.
And how much of this is like biology? There's been a lot of misinformation about PSA and, Black men do tend to get it more often, more aggressive. Why is that? Is that connected to biology or genetics or?
There's one of the largest funded studies from the National Institutes of Health is actually investigating that very question and looking at multifactorial contributors, genetic factors involved with different ancestry groups, as well as social determinants of health and effects of things like stress or neighborhood factors. So everything is multifactorial, and I think we just continue to learn more and more. Actually, one of the projects I'm working on right now is looking at microplastics in prostate cancer. We just presented this at a big cancer conference. I studied samples from 10 patients with prostate cancer who had their prostates removed, and we found microplastics in 9 of the 10 patients' prostates, like literally like pieces of water bottle in the middle of the prostate. And there was a higher concentration of plastic particles in the tumor compared to benign tissue from the other side of the prostate. So this is all very early in terms of microplastics specifically, but there's all kinds of factors: air pollution, neighborhood greenness, what you eat throughout your lifetime. I mean, red meat, processed meat, these are associated with an increased risk of prostate cancer, physical inactivity. So cancer risk is really just very multifactorial. And prostate cancer is really about 50-50. They've done twin studies looking at identical twins and fraternal twins to try to parse out how much of this is genetics versus environment and things like that. And it really seems to be about half and half for prostate cancer risk, where half is your genes. So unfortunately, this is what God gave me. So here we are. But you know what? There's still another 50% that we can work with. And so I that gives me hope,
As we look at some of the new things, I was diagnosed about 12 years ago. For me, it was my PSA went up 0.6 over about a 6-month period. And actually, with the DRE, my primary care physician, who had been my primary care physician for years, even said that he felt something different. I thought that was pretty amazing. I was like, wow, all the patients you have. So I was diagnosed, I think my PSA was maybe 2.1 or something like that. And I know that I had a biopsy pretty early on because it had gone up 0.6 and ended up having 3 biopsies, but that's a whole nother story. But now I look at some of these things, I'm like, well, maybe, and it was slow growing. So it wasn't anything that was aggressive. It was still located in the prostate. I see things now like this 4K score and the PSA 3 test. I guess that's the urine test, and prostate health index. And you mentioned early on that there are things in MRIs now, that there are things that can be done. And are these things in addition to or instead of some kind of biopsy when you go in with the needles and it's not the most comfortable experience?
Yeah, you know what? I think these tests, prostate health index is an FDA approved test, all these different markers, MRI, so helpful. These tests are allowing us to forego biopsies for a lot of patients who, before these tests existed, we didn't have anything else other than the PSA. So if it went up, biopsy and the needles was the only way to find out what's happening. Now, through even a combination of these tests, for example, there were studies where you combine the prostate health index, which is a blood test. It's actually just different forms of PSA. It's actually just 3 different forms of PSA in one blood test. So you could think of it as like a souped up PSA.
Can you talk about the 3?
So it's the total amount of PSA, the fraction of pro PSA, and the fraction of free PSA. So it's just kind of like how the PSA is circulating around in the blood. And by calculating the relative concentration of these forms to the total value provides more specific results for identifying significant cancer compared to just the total level by itself. And then MRI, that's really helpful, right? Because before we didn't have any kind of imaging that could really identify tumors in the prostate. And MRI, I would say, if I had to pick what is the most transformative development in prostate cancer during my career, I think it is MRI, because not only does it help us determine somebody's risk of having cancer, but it allows us to target the biopsy. And you know what? That makes a big difference, because there's no other solid organ in the body that I'm aware of where we just biopsy randomly. So, I'm a female. If I was going to have a breast biopsy, hopefully never need one, but if I did, it would be directed at something that they saw on imaging. They don't just randomly biopsy around the entire breast. But that's what we've always done for the prostate, because there was no imaging to guide us to where we needed to look. So you just figure if you take, 6 samples on that side and 6 samples over here, if there's a big enough rotten area in the middle of the apple, those needles will hit it. But they may not, it samples only about 1/1000th of the tissue. And so without having some imaging to guide it. And so you can see the pathway for prostate cancer detection has just come so far compared to 10, 20 years ago. And I think that is what has helped to remove this whole controversy about PSA, or at least to dampen it. It's because now we do have all these other tests that can just make the whole process more informed. And in Europe, they aren't even doing biopsies if the MRI doesn't show something suspicious. Now, America, we leave the door open a bit more. If somebody's still worried, MRI is about 91% in terms of negative predictive value. So what that means is that like 9% of the time it could miss something. So really, really excellent, but not 100%. So in America, if you are very worried about that 9% and you just want to do the biopsy anyway using the old approach, just the random sampling, since we didn't see anything on the MRI, that still happens here. In Europe, since the MRI is 91%, if it shows something, we do a biopsy. If it doesn't, no biopsy.
I said that the 3 biopsies were another story, but actually it kind of fits right in what we're talking about, because the first biopsy did show cancer. And then I took a second biopsy to be possibly part of a clinical trial. And that biopsy came back, and they went in the same area, and it came back clean, no cancer. And then I had to wait another 6 months, and then the third biopsy came back, and there were other areas that they found. But to your point, the second time you went in the same spot, you thought, right? But you can't be exact on that. And there was no cancer. That's how I ended up with 3 biopsies. So by the third time, I was like, oh, okay, we can do this. I think I can handle it now. So when you go in and there is a concern, are these options normally the options that are given, and I guess I'm just talking about advocacy for yourself to say, can we do this? Because I think I heard someone say now that the MRI is the manogram as opposed to the mammogram. And is it pretty wide? I mean, I don't know. I've had guys that have said after my PSA went up, I got a biopsy and I hated it. I don't want to get another one. Should we go in and say, well, what are my options? And let's look at how about the PSA 3 test, the urine test? I remember when that was a clinical trial at one point.
Yeah, that's out there. We don't really use that as much anymore because some of the other tests seem to be better at identifying significant cancers. But definitely, I think for any of the listeners, if anyone ever hears that their PSA is elevated, asking about other options, other tests that can be done to evaluate it is a great idea. Thankfully, I do think MRI has become much more widespread. In the early days, part of the problem was just with insurance coverage, where we had a lot of difficulty getting insurance coverage, and it's just something that's too expensive for people to pay out of pocket. Now, I haven't really had any insurance issues with that in quite a long time. So I think that has really aided greater availability and uptake of the test.
And what about the new test where you used to get a bone scan, but now you have the
PSMA. Yeah, the PSMA PET, I mean, that's been really transformative, on the other end of things for people who already have cancer. It's just a more precise staging tool to determine if the cancer has spread anywhere. So, could add that to the list of transformative developments that have occurred in my career, and certainly on the tail end for anyone who's already been diagnosed. And they are even starting to look at whether this could be used in the setting of detection. So who knows? It may even move earlier at some point. But at present, we're really using MRI for identification of prostate cancer and targeting of biopsies. And we're using PSMA PET for staging of cancer and even restaging in somebody who is having a recurrence after treatment.
Yeah, well, that's me. Well, not after treatment, but 12 years later. So I had my first PSMA a couple of years ago when I had a biochemical reoccurrence, I guess. And again, based on the PSA going up to 0.25, nothing showed up, but the PSA kept going up. And then when it got to be 0.47, I did have proton therapy in the prostate bed, which so far things have been undetectable. So that's a good thing. But I didn't even know about the PSMA until, they ordered it. And I was like, okay, what's this? And kind of did my research. So someone has a PSA that's slowly increasing over time. What questions should he be asking his doctor or?
Well, one question is, could other tests be helpful? Other blood tests, other urine tests? Would an MRI be helpful?
I had a friend of mine, and he's actually been on the show, and I know that was always a source of anxiety. The PSA was kind of creeping up, and then it would go down, and he would be happy that it was down, and then it would go back up. So he was kind of riding that PSA wave, if you will. For somebody who's going through that, what would you tell them?
Well, first of all, I think this is the reason why the guidelines recommend repeating the PSA before taking any action, because it can fluctuate and for a variety of reasons. And, sometimes I see it ordered in the wrong settings by doctors. I have seen numerous patients who were in the emergency department because they had a urinary tract infection, prostatitis, or urinary retention where they couldn't pee, and a PSA was sent in the emergency department. And a urinary tract infection will cause the PSA to go way up. And if you're in urinary retention where you can't pee, it will cause the PSA to go way up. And so now you're just sending a test at the time where it's going to give a totally spurious, false, and misleading result, causing anxiety for the patient. Now it needs to be repeated. So it's just it's a mess. So unfortunately, what can we do? But yes, for the patient who is experiencing some fluctuations, that is a setting where something like an MRI can be helpful to see, is there anything concerning in there? Or, is it all just prostatitis?
Let me ask you this. I've heard that if you have sex and then the next day you get your PSA, it will be elevated. Is that true?
I mean, not necessarily. It can fluctuate with a lot of reasons. But again, this is why it's best to always repeat the value if there's any concern. Most things that you would do on a daily basis are not going to cause such a huge change that it would be in the abnormal category if it wasn't already. But a urinary tract infection does. And urinary retention, where you can't pee, or if somebody puts a catheter in your bladder, those are things that can upset it enough that it would actually be in the abnormal range.
Well, let's talk about this shift here as we kind of close out. PSA monitoring, whether it's just keeping an eye on things or if you've been diagnosed and it's active surveillance, often this starts a man's prostate journey. And what are things that we can do to reduce our risk of prostate cancer and really to have good prostate health?
Well, this is one of my favorite questions. This is why I even went back and got my dual board certification in lifestyle medicine. The 6 pillars of lifestyle medicine. Pillar number 1 is whole foods, plant-based diet. Okay, so really important. So the goal here, especially important, would be to try to reduce or, if possible, eliminate from the diet red meat, processed meat, and dairy. Now, if somebody doesn't want to go full on vegan, even vegan plus fish would be a preferable option from the perspective of prostate health, but also heart health, because they're really kind of the same. And by the way, heart health is erectile health too, because the penis is like an extension of the heart. Those blood vessels down there controlling erections are smaller than the ones in the heart and the neck. So anything that's going to cause cholesterol buildup, inflammation in blood vessels is going to interfere with sexual function. So we really want to move towards whole foods, plant-based. Now, that's not Whole Foods, the grocery store. This is whole foods, meaning like whole unprocessed foods. So we're talking about the perimeter of the grocery store, the produce, the stuff that is not in a plastic wrapper that's highly processed. Now, this does not mean low carb. You don't have to avoid carbs. What we're trying to do is avoid refined carbs. So whole grains are actually great. In fact, fiber is really beneficial for patients with cancer and really for everybody. It helps with bowel function, etc. And fiber is only found in plant foods. So whole grains and things like quinoa, that's a complete protein, it's filling. Lots of very delicious plant-based options. So I encourage everyone to move in that direction. Even small changes can be very helpful. But interestingly, people who make more intensive lifestyle changes are often the happiest. And you'd think, is it hard to adhere to these things? But the interesting part is the people who really go the most extreme, they do see the most extreme changes. So for my lifestyle medicine boards, you have to present a case of somebody who you worked with in your practice through lifestyle change and show all their numbers and what you did. And so the patient that I worked with actually was able to reverse his erectile dysfunction and lower urinary tract symptoms by doing a whole foods, plant-based diet and physical activity program. So if we're talking about really to go off of medications for chronic diseases or to significantly change the trajectory, that does require more intensive changes. But even small changes do make a difference. So that would be the first thing, physical activity. Okay, now most Americans are not meeting the guidelines for physical activity. So we want 150 minutes a week of moderate intensity. So that could be, 5 sessions of 30 minutes, whatever denomination. And then resistance training, and 2 times a week. And this is important for bone health, especially important for our patients with prostate cancer who are taking hormones, which can really cause problems with reduction in muscle mass, with bone density, with gains in fat. So in that particular prostate cancer population, the resistance piece becomes even more important. And sleep health is another pillar of lifestyle medicine. I don't think it gets enough discussion in prostate cancer, but it's just so important when we're involved in any kind of condition, because sleep disturbances increase the risk of almost every chronic disease, as well as mental health issues, accidents, you name it. And there's a lot of sleep disturbances in the prostate cancer population. And interestingly, there's this systematic review that found that disturbances in circadian rhythm and sleep seem to be associated with higher risk of prostate cancer. So they've started to look into this a bit, and it appears that some of these clock genes, like the circadian rhythm genes, are actually linked with prostate cancer. So stay tuned. It's an active area that's I think is very interesting. But, making sure you get good sleep. And if you have risk factors for sleep apnea, get a sleep study. And if you're just having insomnia, just good sleep hygiene. Going to bed around the same time every day, no bright light at night. bright light first thing in the morning. No sitting there on the phone doing emails right before bed. So I think we all kind of know what we should be doing. It's harder to put it into play. And then the last thing I'd say is, avoiding smoking because, of course, for overall health, but it is associated with a higher risk of prostate cancer mortality or death from prostate cancer. And if that's not enough to scare people, I do think that often what gets people's attention is that it is associated with erectile dysfunction too. Just like eating meat is associated with erectile dysfunction. So if you aren't concerned about cancer risk, but you are concerned about sexual function, still all the reason to consider these healthy lifestyle patterns.
What about alcohol?
Yeah, it's a great question. So the data on alcohol for prostate cancer specifically aren't as strong, but it is certainly linked with other forms of cancer. So there's been a lot of back and forth in guidelines. Previously it was like females, 1 drink per day maximum, males, 2 drinks per day. But now some groups are suggesting really that there's no safe limit, which is, not so much fun. But really a lot of that data is as respect to other cancers, more so than prostate.
So let me ask you this, Doc, before we go. And let me just say something about the sleep apnea. Every time I have my physical, and I do have a CPAP, I do use it sometimes more than others because it can get a little frustrating sometimes. But he showed me this diagram of how everything that sleep apnea and not getting enough sleep affects. I mean, and it was from the top of your head all the way down to your toes and everything in between. It is the most amazing thing. It's scary, and I was like, okay, I gotta get better at this sleep thing because so many things are connected. But I understand. I was actually a vegan for a long time, and then kind of became a vegetarian for a while. Then I fell off the wagon. My wife and I both were saying the other day we have got to get back to our diet.
You know what? We can't look back. It is never too late. One program I really like is the Rochester Lifestyle Medicine Institute. They have these virtual jumpstart programs every single month, actually. They offer with physicians and health coaches to help people with, implementing a whole foods, plant-based diet. They also have like a sister program for stress reduction and positive psychology. So I think if anyone, out there is listening to this and wants to get more plant-based but doesn't know where to start, going to something like the virtual program from the Rochester Lifestyle Medicine Institute could be like a really helpful starting point, just to be part of a group of people who are doing this with a lot more hands-on support. I happen to like Purple Carrot meal delivery service for people in the United States. They're all plant-based meals. If you don't want to have the box delivered or pay for it, luckily they give all their recipes for free right on their website. So very delicious options. I actually use it myself. It was recommended to me by Dr. Scott Egner, another urologist, and a lot of the urologists involved in prostate cancer use Purple Carrot. But it was so helpful because I started my plant-based journey about 6 years ago. I liked a good steak just like the next guy, right? But I decided, you know what? The research is really clear, and every way we ran these studies on this, it was just better for everything. And so I just couldn't ignore it. And I think doing these recipes from the Purple Carrot site really enable me to learn what foods to eat and what to cook, and they're delicious. And I don't miss the other stuff. I really don't. I don't think about it. I'm happy. So I think, you know what, there's hope.
I'm glad you mentioned some resources because that was going to be a follow-up question. We know what we need to do. A lot of people are like, hey, I got to do this. I got to exercise. And it's just getting motivated. It's just getting help to get to that point. And I'm glad you mentioned the resources. And when we were vegan, even, I mean, we did tofu eggs, well, my wife did. I didn't do much, but, it took some preparation, but it was delicious. And I did not miss eggs. The biggest challenge was just outside of the home, making sure you were deliberate in, what you're going to eat, and looking at places, if you're going to eat, to have some vegan options and or vegetarian options, which many restaurants today do, which is a good thing.
Yeah. You know what? I think we're lucky, or, I'd say I'm lucky because I only came into this 6 years ago, and probably 20 years ago, this would have been just totally impossible and awful. Right. But you know what? It's like everywhere now. And I will recommend another really critical resource. It is Happy Cow. It is an app and a website, Happy Cow. This app finds plant-based food anywhere in the world. So I travel all the time for prostate cancer meetings, and I'll get off a plane in Mexico, Sweden, Egypt, and it geolocates you and shows you everywhere that serves plant-based food around you. And I used it in Egypt and Jordan a couple months back when I was over there for some meetings. I've used it in Latin America, in Asia, in Europe, in America, and it's crowdsourced. So people put in pictures of the foods, and so I think Happy Cow, it really makes it so that no matter where you are, it should be easy. And I think a lot of people have myths about plant-based, like that it's, more expensive or some sort of bougie situation. There has been no time ever that buying dried beans and lentils was more expensive than buying meat at the grocery store. Like, said nobody ever, right? Some people don't have easy access to fresh produce because of where they live, or they're just busy and can't have that all the time. And I'm guilty of this. But the great news is that frozen produce has as good or possibly even better nutritional benefit because they flash freeze it at the time of greatest ripeness when the nutrients are there. So you don't have to have fresh produce all the time. Just keep a bunch of your favorite fruits and vegetables in the freezer, and then they're there. And usually these are some options like frozen produce, beans, lentils, that are extremely affordable, available, and just such great choices for prostate health and overall health.
Yeah, one thing we said, if things get really bad, there's always brown rice and beans. So you can always have that. You can get a big old bag of rice and dried beans, and you're good to go. But yeah, I appreciate that, and we'll put all of those resources in the show note for this particular program, because it is about giving people information and to help. And I can tell you that when we were vegan, the aches and pains that I'm getting older, so there are aches and pains, but the inflammation was there. It wasn't there. I mean, everything just really worked so much better. And I will just say that since my cancer came back, and I did the proton therapy, and I remember having a conversation with the nurse, and we were talking about the fact that cancer and even prostate cancer, it's a molecule, right? It's you hope you get it all, but the thing is, don't feed it. Don't do things that can cause this one molecule, if it's still floating around, to start to multiply. Do what you can on your end. And this is one of the things that we all can do. And it helps with diabetes. It helps, across the board. And so I'm fired up. I want you to know that, particularly after I listened to one of your sessions, that's when I said to my wife, because we've been talking about it, I said, we have got to getting back to the gym, which has really been helpful. And as much as I hate to go, I always feel better when I come back. But man, getting there is always a struggle. I want to just thank you. Any other resources you can think of, or if you think of something, you can always reach out to me and I'll put it in the show notes. But is there anything else that comes to mind?
Yeah, for sure. Well, I mean, I guess if anyone wants to hear more information about these topics or chat with me, I host the Men's Health Show. It's on Sirius XM channel 110 on Wednesdays from 6 to 8 p.m. Eastern time. And, we always have a prostate health segment on my show. So once a month, there's a prostate health show. And we take live callers. So if anyone out there has questions about their case and wants to discuss it with us on air or send us an email, So, hope to help out if anyone is interested.
Thank you. We're going to put the link as well. And I have Sirius XM. I've listened to the show. So folks, it's a good thing to have. And you don't have to have a car, right? You can get the app and get all of the lineup as well. So I'll be tuning in, and maybe I'll call in a couple of times. I'm sure I have some questions for you. But I want to thank you for answering my questions and coming on today. I know how busy you are, and just thank you for helping us kind of bring clarity to a conversation so many people need to hear, and for the work you continue to do to educate and empower patients every day. Just again, we appreciate all that you're doing and look forward to new information, guidance, as we go through this journey. So thank you so much for joining us.
Thank you for the invitation. It was a pleasure.
So don't forget to check out Dr. Loeb's work on SiriusXM, where she continues these important conversations about men's health and prostate cancer awareness. I'm going to be tuning in and calling in as well. That's important as we talk about this particular podcast, is that this is a conversation. And we hope that if this has helped you, that you would like it and share, subscribe. And when you subscribe, you're alerted to future episodes. You can also visit our website, ifyouaremybrothers.org, to learn more about our other projects. We have the podcast series. We actually have a documentary that we are finishing up, revising, that will be coming out in September. And also we do a lot of community engagement work as well. And if you're interested in us coming to your community, reach out, let us know. We'll pack up all our stuff and come out and talk to folk and be a part of whatever effort you're putting on. If it's a church, fraternity, organization, we'd love to do that. Now, If You Are My Brothers is a nonprofit 501c3 project of Straight Street Media. And what we are trying to do with If You Are My Brothers is to dedicate turning prostate cancer awareness into what we call health action. So we want to take you from health awareness to health action. That's one of the reasons I was asking Dr. Loeb about some practical things that we can do. And she was a wealth of information. It is about knowing, but it's also about doing, because that's how we make a difference. You can make a difference by supporting what we do here at If You Are My. You can make a contribution to continue our work. And when you do make that contribution, we will send you your very own If You Are My Brothers mug. I want to thank Atlanta Brand Central for providing the mug for us and redoing the mug. And we had a black and white one. Now we got full color. It's a great thing. But that's yours once you make a contribution, and just our way of saying thank you for helping us in our mission. We want to say special thanks to our producer, Danny Garcia Pozo, who is doing all the great things behind the scenes. And also, we mentioned earlier today, at the beginning of the show, Zach Reynolds at Borkhouse Productions for our opening. And both Borkhouse Productions and Atlanta Brand Central are always in our show notes. So we want to thank both of them for helping us out. Remember, this podcast is not a substitute for medical advice. We want you to always talk to your healthcare provider, healthcare team. That's important. So that being said, until next time, remember, if you are my brothers, you'll share this message. Until then, take care, stay healthy, and keep the faith. Peace.